People have different needs when it comes to deciding what treatment is best for them, and everyone responds differently to the treatment they receive. Your healthcare team will work with you to decide what treatment is right for you. Some adults with mild ITP may not need any treatment, but are monitored with occasional blood tests. In some people with ITP, their body might not be producing enough platelets. But ITP can also be caused by a person's immune system attacking their platelets and stopping them from working properly. These platelets are then removed from their body quicker than usual. The goal of treatment is to increase your platelet count to a level that allows normal clotting. There are initial treatments recommended for ITP. If these don't work, other treatments can be used. The initial treatments recommended are steroids or intravenous immunoglobulin, also known as IVIG. Steroids stop your immune system from destroying your own platelets. Whilst taking steroids, your white blood cells may not be able to work effectively, so frequent steroid use can cause recurrent infections. IVIG treatment contains antibodies from blood donors. These antibodies are used to stop your white blood cells from destroying your own platelets. Therefore, both steroids and IVIG can be used to increase your platelet count. If the initial treatments leave you feeling very tired or your condition worsens, it is important to make notes and talk to your healthcare team. They will assess your symptoms with you and look at other treatments. Alternative treatments include thrombopoietin receptor agonists, also known as TPO-RAs, or a splenectomy. The spleen is an organ that filters blood and is part of your immune system. With ITP, your platelets can be destroyed in different parts of your body, but the most common area is in the spleen. For some people, the removal of the spleen can offer a long-term solution. This is called a splenectomy. A splenectomy might not always control your ITP because everyone is different when it comes to how their ITP develops. Like with all surgeries, there are associated risks, but your healthcare team can talk you through any concerns you have and discuss whether surgery is the right choice for you. Thrombopoietin, also known as TPO, is a hormone in the human body that plays an important role in platelet production. TPO-RAs work in a similar way to natural TPO by targeting TPO receptors on the cells that produce platelets. Targeting the TPO receptor will tell the cells to make more platelets. Whilst using TPO-RAs, your blood is monitored to see if the treatment is working effectively or if the dose needs adjusting and to look out for possible side effects. Steroids and IVIG increase platelet count in the short term. Other therapies, such as a splenectomy or TPO-RAs, have been shown to maintain platelet levels over time. Everyone is different when it comes to choosing the right treatment and managing symptoms. Your healthcare team will be able to talk you through your options. It's important to tell your healthcare team about any medicines you're taking, as they could interfere with your treatment. You should also avoid medicines that affect how your platelets work, such as aspirin, ibuprofen, or some herbal medications. If you have any concerns about your ITP or your treatment, your healthcare team will be able to answer any questions you may have. Tracking your treatments and your symptoms will be helpful to your healthcare team and will allow them to understand if you need to find another treatment better suited to you. You can track your symptoms, treatments, and note questions to ask your healthcare team with the downloadable ITP Pocket Log app. Want to learn more about ITP? Watch the rest of the videos in this series. Just visit the ITP Support Association website at itpsupport.org. For advice on personal medical matters, or if you have questions or concerns, please consult your doctor or healthcare team.